I just had a chance to sit down with Dr. Michael Ross, a very high respected obstetrician, to talk about how to plan for a baby. This is a must listen to. Let's go to the clip. Okay, so let's just say I come and I see you, I'm with my wife, and we say, okay, listen, we're planning on having a baby, we're going to work at it, and I say to you, I say, what are the most important things, or my wife says to you, what are the most important things I should stop doing right now?
Okay, rather than stopping things to begin with, let's start in the affirmative. Let's see, what things do you have to do first? So one is taking control of your own health, right? And we'll get to these behavioral issues and your social customs like alcohol and cigarettes in a moment. But first start looking at your own health. So are your vaccines current? There are a number of infections such as German measles or rubella, hepatitis, chickenpox that can be very, very dangerous if you have them, particularly early in the pregnancy. And oftentimes you don't know that you're having that viral illness. So very important to start with your doctor and check to see if your vaccinations are up to date. If they're not, do the vaccinations before you get pregnant, right? So that's a critical issue. Then what else do you want to look at? You want to see, do you have any ongoing medical illnesses, any heart disease, diabetes, which we know is rampant now in society, asthma, high blood pressure, or gastrointestinal disorders? It's most important that you go not just to your obstetrician, but to your general practitioner and get those conditions under good control. It turns out that whatever medical condition you have, it does much, much better during pregnancy if it's controlled just prior to the time you get pregnant. And whether that's an inflammatory gastrointestinal disorder, whether that's asthma or even high blood pressure, controlling that before the pregnancy is critical. Now, particularly, you take a disease like diabetes, and there, the level of glucose or your lack of control can be very detrimental to the baby. So it's critical that diabetes is controlled very, very early in your pregnancy, sometimes even before you know you're pregnant. So again, control those chronic medical conditions. And with that in mind, are you taking any medications or any over-the-counter supplements or herbal medications? Very important to discuss those now with your obstetrician. Now, clearly, if those are medications that you need for some chronic medical condition, you have to coordinate the issue with your obstetrician and with your general practitioner, because there are a number of medications that can be detrimental during pregnancy, and yet others that are essential to take for your well-being. Some of the herbs we want to stop because they can cross the placenta and affect the baby. Even some simple medications like acne medications can cause abnormalities and malformations in the baby, such as retinoic acid. And then finally, what do you need to start taking? So we need to start prenatal vitamins, particularly vitamins that have folic acid in them. Even though both Canada and the United States have folate supplementation in our breads and wheats and grains, very important to start prior to the pregnancy prenatal vitamins with folic acid.
Now, does the folic acid reduce the risk, defects, or different issues that could possibly happen in a pregnancy?
Right, it truly does. The folate, whether that's for someone having their first baby or for someone who's had a baby with a previous malformation, and these malformations are in the class we call a neural tube defect. That's a brain or a spine abnormality like a myelomeningocele or an anencephaly. If you've had a previous baby with a very serious complications like that, you need actually a higher dose of the folate prior to pregnancy. Remember, this baby is developing during the embryonic period in the first 10 weeks, right? And that includes from the time of conception, right? So you may not recognize that you're pregnant until you miss a period. By then, that embryo's been developing already for 2 weeks. By the time you have your pregnancy test, you make your appointment, your embryogenesis period, and this period where malformations can be prevented or can form may already be over. Well, let's come back to what you spoke about earlier, some of your lifestyle issues.
Sure.
We want to remind you now to avoid alcohol, avoid illegal drugs, cigarette smoking, and to be aware of what kind of work environment are you in. Are you exposed to toxic substances? So whether you work in a chemical plant, whether you work around radiation, perhaps even a hairdresser because they're exposed to some of the dyes or cleaning service.
Really?
So we want to think carefully about your exposures.
Everyday life is a threat.
It really can be. I mean, driving in the car can be a threat. Certainly your snowstorms up in Toronto can be a threat. Pregnancy, we want to do everything we can to avoid that threat. And the preparation that we've been talking about, the planning of the pregnancy, spacing the pregnancy is an important issue. So you don't want to get pregnant right after you've had a previous child. It's best to wait probably a year at least to have the next baby. One is that allows your body to get back to normal, allows your weight to get back to normal, a very important topic we can talk about in the future, reduces the risk of prematurity, and very importantly, allows you to really care for the last baby that you had. Give that baby all the attention for at least a year.
That's a great point. Wow.
So lots of opportunity to plan the pregnancy and really care for yourself, get everything in control and organized. And not only yourself, but as you mentioned, ideally the woman and her spouse are coming into the office. You really have to address not only your lifestyle, your partner's lifestyle. And pregnancy is a life changer, having this baby. So one has to think of your emotional well-being, your physical well-being, your social and financial well-being, because there is a huge responsibility, as we all know, for the next 18 or more years in caring for this child.
So do you find it that a lot more people are coming to you now and trying to get the pre-pregnant advice and the pre-pregnant planning, or is it, or what's going on in the States, or is it just, rather than being proactive, they're being reactive to a situation? Oh, we just found out we're pregnant, now what? Rather than, you know what, we really want to have a child, we want to make sure we do everything possible to have a healthy child.
Ideally, we would do all the pre-pregnancy counseling and planning. Unfortunately, still the majority of patients I see have not planned.
And that's part of human nature, I guess, right? I mean,
that is, and probably the younger you are and the first baby you're having, it's not planned.
Yeah.
So we need everybody to remind them of that planning. And that's really the responsibility of both the father and the mother. So we could talk about genetic screening for different ethnic groups at some point in the future. But as a general rule, you first want to look at, do you have any family history of medical conditions? Is there anything that pops out now that runs in the family? Mm-hmm. Because those can be tested. Even mental retardation among family members is a specific genetic syndrome, often inherited as something called Fragile X. And so one really wants to look at the family history. One wants to assess your own age, particularly the mother's age. As you know, after arbitrarily an age such as 35, the incidence of chromosomal disorders increase. Now that can be tested for. But as you say, there are a number of recessive genes. Recessive meaning that you have to have one of the genes from dad and one of the genes from mom in order to have that syndrome present. Now, you and I and everyone all have a certain number of recessive genes if we test each other. And the probability with our mixing of population is that we rarely have people match up and have those two recessives come together. When they do, that's very concerning. Mm-hmm. Certainly, as you point out, among the Jewish population, there are a number of genes that can be tested for to see if you are at risk. And among others, we're gradually increasing and rapidly increasing the number of recessive traits that can be tested for. A again, that becomes a big controversy now.
Yeah.
Of how many genes should I be tested for? What's the cost of this? What's the implication of this?
Well, see, in Canada, there is no cost. That's the great thing about being the Great White North.
Right, right. As long as you can get an appointment there.
Oh, we get an appointment. Don't worry.
We can do this bantering between Canada and the U.S. And
so we.